The following segment is sponsored by Providence Health and Services. This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. K2 and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because K2 and Providence Health and Services know that family matters.
Flu season is upon us, and if you haven't received your flu shot yet, now is the time to get one. Here to share important information, we welcome from Providence, infectious disease and infection prevention expert, Dr. Justin Jin. Good morning, Doc.
Good morning. Thanks for having me on.
You bet. So what can we predict, and what are experts forecasting about this year's flu season?
Yeah, so, looking at data from the CDC, they are expecting a moderately severe respiratory season with a moderate amount of flu activity this year. Obviously, it's just a prediction, but what we can see from the data from the Southern Hemisphere, this is their expectations. Last season was one of the worst flu seasons we had on record, with about 2 to 3 times higher hospitalizations than we had seen in many years. In the United States alone last year, we had over 600,000 hospitalizations with almost 30,000 deaths, including over 200 pediatric deaths with 2 children that died in Oregon, unfortunately. So, it's going to be, it's hard to predict, but, we're looking at most likely a moderate to severe respiratory season this year.
Why was it so bad last year?
It's hard to know. It was kind of a strange year. There's 3 main strains of influenza that circulate. So there's usually 2 main influenza A. So there's the H1N1 pandemic strain that we've been seeing since 2009. And there's usually an H3N2 and a flu B. Usually for the flu A, we usually just see one predominance of either H1N1 or H3N2, but for whatever reason last year we had both flu A's that were fairly prominent.
Wow.
So it was definitely a strange flu season, and the hospitals last year, I can attest to, were impacted. We had a lot of hospitalizations, which definitely impacted our ability to be able to provide care to our communities. Because a lot of the hospitals throughout the Portland metro area and throughout the state were on divert for a lot of flu season last year. So it was a difficult season.
Who should get a flu shot? And are there different kinds for different age groups?
Yeah, so the CDC just approved recommendations that anyone over the age of 6 months old should get the flu vaccination. People that are definitely the highest risk at severe influenza are going to be our patients or individuals that are over the age of 65. And we see that from hospitalization data that these patients that are greater than age 65 see a lot higher severity of disease, which might make them seek out medical attention or get admitted to the hospital. Patients also that have underlying immunosuppression should also we highly recommend these individuals to get vaccinated. There's many different types of flu vaccinations available out there. Including, there's recombinant and cell-based flu vaccinations with people with severe egg allergies, or patients that might not want to have a egg-based product if they're perhaps like vegan.
Right.
Those are also available. There's also high-dose flu vaccinations that are available as well for individuals 65 and older, which may induce a stronger immune response in this population.
Do we know how effective this year's flu shot is going to be? And we can still get the flu if we get vaccinated, can't we?
Yeah, exactly. That's a great point. So, in general, from year to year, we generally see about roughly about a 50% efficacy of the flu vaccination. And the CDC just published data a few weeks back with data from the Southern Hemisphere. So, being in the Northern Hemisphere, we have a little bit of an advantage to be able to see the data that comes out from the Southern Hemisphere, because they're just getting through their flu season right now. And it did look like it was a fairly decent match with the current vaccination strains that we have in our vaccine, and it was about 50% effective at preventing disease, and also was pretty effective at preventing individuals from having to seek medical attention or go to the hospital.
How long does the flu actually last? Like 5 days, 6 days?
Yeah, on average, you're looking at about 5 to 7 days of symptoms. Often kind of having that, the classic kind of fevers, body aches. So generally, those are going to be the major symptoms. Sometimes, cough, runny nose, sore throat. Usually about a week is what most individuals will get through it.
And when do we know we need to go to the ER?
Individuals that are having, worsening symptoms, if you start developing like shortness of breath, or if you see somebody, like especially a child, that's breathing really heavily, or if you notice their lips are blue, their mucous membranes are looking kind of palish blue, that could be a warning sign. If you start having any types of chest pains, confusion, lethargy, difficulty keeping like fluids down, seizures, especially in young children, are definitely going to be warning signs that they need to seek medical attention. Yeah. There are effective antiviral medications out there. There's a drug called oseltamivir or Tamiflu, which is available for patients who have influenza. And it's preferably given within the first 48 hours of symptoms. So if you do develop flu-like symptoms and it is in the midst of the flu season, it's a good idea to speak with your medical professional.
Sounds good. We want to tell everyone, for more information, including where you can get a flu shot at Providence, visit our website at KA2.com/Family Matters. Doctor, thank you so much.
I appreciate it. Get your flu shot. I got mine today.
I'm getting mine.